Cold sores are a very common virus infection caused by herpes simplex virus, usually type 1. Now, about 1 in 5 people has a cold sore, usually around your lips or maybe around your nose. And you tend to get your first infection when you're a child. Once you've had an infection, that virus will lie dormant. You don't know that you'd had it if you looked at yourself until it gets triggered again. The sort of triggers that we're looking out for would include stress, sunshine, being generally unwell, and rather oddly hormonal changes, so some women may find they're much more prone to getting them round about their period. It tends to start off with a tingling in the skin, and then you get a blister which crusts over. Overall, it lasts about a week. During that time, and in fact any time from when you get that first tingling, it is very infectious. So while you're fine when you don't have any signs of a cold sore, you must be very careful to avoid, for instance, kissing babies and to avoid oral sex, because it can be passed on through oral sex while you've got an active blister. You want to treat at the very first sign of an infection when you get that tingling. Antiviral cream will almost always do the trick, and you can get it from your pharmacist. But do be careful. Firstly, try to dab the cream on. Wash your hands really thoroughly afterwards and try to avoid touching your cold sore at all if you can, but particularly do not touch your eyes after you've touched your cold sore. You can consider factor 50 lip balm or high protection lip balm because that can reduce the risk of it coming out. I wish I could tell you just to avoid stress.